Hi, I'm Laura Bates, and today for my informative speech, I'm going to be talking about bipolar disorders. Every day in America, millions of individuals suffer from a variety of mental disorders and illnesses that oftentimes may go unnoticed. We may never guess that the muscular, good-looking man standing in front of us in line at Target suffers severe depression and mania at times. Bipolar is one of the most common mood disorders of the mental illness family. About 5.7 million people in the United States, both men and women, suffer from bipolar disorder. At least half of all the cases of bipolar disorder start before the age of 25, and that is from the National Institute of Mental Health. Most people start showing signs of bipolar in their late teens. The average onset of symptoms is the age of 21. The signs may be dismissed as growing pains or normal teenage mood swings. On occasion, some people have their first symptoms during childhood, but the condition can often be misdiagnosed at this age and improperly labeled as a behavioral problem. Bipolar disorder may not be properly diagnosed until the sufferer is between the ages of 25 and 40 years old, at which time the pattern of symptoms may be more severe and more clear. The symptoms can also become dangerous because the disorder has progressed and the individual is now older, has experienced more, making their symptoms worse and maybe more dangerous at times depending on their mood swings. Bipolar is defined by the National Institute of Mental Health as a brain disorder that causes unusual shifts in mood, energy, activity levels, and affects the inability to carry out day-to-day tasks. Bipolar disorder is also known as manic depressive illness, since mania and depression are two very severe symptoms of this disorder. Unfortunately, there is no cure for bipolar, and it lasts a lifetime. Individuals who suffer from bipolar don't just experience regular mood swings, like most people from time to time. The mania and depression can be so severe they may lose their job, drop out of school, destroy close relationships, or get in trouble with the law. The early symptoms of bipolar, as I stated before, may be brushed off as typical mood swings, feeling low, or feeling very excited. But as the disease progresses, the symptoms worsen. One early symptom of bipolar is hypomania. According to PsychCentral.com, 2012, a state in which the person shows a high level of energy, excessive moodiness or irritability, and impulsive or reckless behavior is hypomania. It may feel good to the person who experiences it, and when friends and family learn to recognize the mood swings, the individuals will often deny that anything is wrong. This is usually the beginning of bipolar disorder, when the mood swings begin to affect their healthy, normal, everyday living. Mania and depression are the two most common symptoms of bipolar. The common mania symptoms of bipolar include elevated, expansive, or irritable mood, racing thoughts, pressured speech, which is rapid or excessive speech, decreased need for sleep, feeling like one has superpowers or superlative talents or faults, rapidly changing topic to topic when speaking, poor judgment. For one to be diagnosed with bipolar, they must experience at least one manic episode, including most of those mania symptoms, at least once a week. And that's cited from Dryden and Edwards, MD, 2012. Mania can be very dangerous to the individual suffering. It can also be dangerous for other people in their lives, as that can lead to aggressive behavior, potentially dangerous risk-taking behaviors, and homicidal acts. That is cited from Alloy M, MD, 2012. The extreme opposite symptom of bipolar is the depressive state. The depression symptoms may include sadness and major anxiety of every aspect of life, including their thoughts, feelings, sleeping, eating, physical health, relationships, even the ability to function properly at work. The individuals may feel there is no way to get out of this low state. According to WebMD 2012, symptoms of depression and bipolar also include sadness, guilt, and anxiety, irritability, loss of energy, hopelessness, worthlessness, a loss of interest, of enjoyment, things that once were pleasurable, difficulty concentrating, uncontrollable crying, difficulty making decisions, increased need for sleep, thoughts of death or suicide, even attempting suicide. That bipolar disorder should be diagnosed and treated as soon as symptoms begin occurring because of the potentially dangerous side effects that this illness may cause. Doctors usually diagnose bipolar disorders using the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders. According to the DSM, there are 4 types of bipolar disorder that an individual may be diagnosed with. These include bipolar II disorder, bipolar disorder not otherwise specified, cyclotron disorder or cyclothymia, regarding treatment for bipolar, there are several options once an individual is diagnosed with bipolar. Medication is nearly always prescribed as part of the treatment process, which is usually prescribed by a psychiatrist. The most common types of treatment used for people diagnosed with bipolar include mood stabilizers, antipsychotics, psychotherapy, and self-help strategies, and antidepressants, which are usually almost always used. Although a person suffering from bipolar may be on medication for the rest of their lives, it doesn't mean that they can't live a normal day-to-day life like everyone else. The prognosis for someone with bipolar is actually a good one because it's a very treatable disorder. According to Bressert S. Ph.D. 2012, most people respond to a medication and a combination of medications. Approximately 50% of people will respond to lithium alone. 10 to 20% will have chronic mood symptoms despite treatment. Approximately 10% of bipolar patients will be very difficult to treat and have frequent episodes with little response to treatment. The average individual diagnosed and treated with bipolar is free of symptoms for about 5 years between the first and second manic depressive episode. As time passes, the time between the episode grows longer, making it easier to live a healthy lifestyle with a stable mood. As you can see, although bipolar may interfere with your day-to-day life, once it's diagnosed and treated, it is very manageable. I hope you learned a lot about bipolar disorder today, and thanks for listening.